Everyone, it's Amy back again from Thin Line 206 to educate you a little bit about a topic that most people probably have not heard of. So, the term that we're going to talk about today is moral injury. Everybody has their own beliefs, morals, and standards that they live by throughout their lives. As you go day to day, you make decisions based on these morals and beliefs. And it's kind of our right and wrong. It tells us what to do and how we want to go about living our lives. So, moral injury is a term that we use in the mental health field to kind of describe that internal battle that people may often have when they experience different situations or scenarios where those moral codes have been kind of broken in an aspect. Like they've had to break their own moral code. They've maybe had to cross that line in breaking some of their own morals and values and beliefs. And so as we talk about that today, I want you to kind of think about your own values and beliefs and what that would be like if you had to go against those and how that would feel and if that would be a long-lasting effect that you would experience. So with moral injury, we're talking about maybe having to follow through with an order. Take the military for an example. And maybe it's something that goes against your own personal beliefs. Or maybe you're trying to prevent something from happening, whether you're a nurse and a doctor trying to prevent somebody for passing away, or an EMT that's, performing CPR and, you're trying to prevent something. Or you witness an event where, what happens kind of goes against your moral code or your values and what you believe. So some examples with COVID and the pandemic going on right now. Healthcare professionals, as I said, like making a decision and someone ends up dying based on a decision that's made. It may have been the best decision in the whole scenario, but we were maybe unable to prevent a death from happening or an injury from happening. Having to choose between caring for your loved ones or caring for your patients that maybe have COVID or keeping your family safe. That's kind of there's a moral dilemma with that. So end of life scenarios is another one, especially in the COVID pandemic and what we're facing right now. Lots and lots and lots of people are dying. And with this, they're dying without their loved ones by their side. And so that is something that's going to weigh really heavily on a lot of our healthcare professionals, nurses, our doctors, because they're on the front lines and they're experiencing these deaths and they're seeing these people consistently, day after day, having to go through these traumatizing experiences, whether it's COVID or it's some other traumatic experience without their family and their support system. And that can be very, very difficult for the individual that is stuck there without any support other than a screen in front of their face and the nurses that they don't really know. So end of life scenarios or just not having that support and you've experienced a traumatic event, unfortunately, in the midst of a pandemic. Some may feel some shame due to the circumstances and, even some guilt and shame in regards to not being able to prevent these things from happening. Or also experiencing these things on the completely other end of the perspective of experiencing these things and not not having any feeling numb, not um, not experiencing any emotion related to it, and that can have a toll as well. Um, or witnessing different policies or unfair or unjust acts that an individual may make them feel powerless. So these are all big examples that are going on right now in our pandemic that all can relate back to and cause moral injury. Some other examples with other fields in mind, when we think about like engaging or experiencing war, even if it's your duty and you may not believe in the mission, for example, that can create some moral injury. Experiencing betrayal by leaders, or just other people that you trust. Making decisions that affect the survival of others, even if all other options lead to negative outcomes. Having to kill, our military men and women having to be on the front lines and experience that, no matter who it is, whether it's a man, a woman, an adult, a child, an elderly person. It's kind of that scenario of kill or be killed sometimes. And to go along with that, even within our own nation, suicide by cop is another one. And surviving a traumatic event for individuals, sometimes they may later question, well, why me? Why was it that I survived and all these other people didn't? Or even my loved ones passed away, whether if it's, just in the general public, and I'm still here, and kind of having that survivor's guilt, so to speak. So anyone can experience moral injury, and I want to stress that, because it's not just our frontline workers and our first responders and our military personnel. Although they do experience a lot of this day in and day out at their jobs, on top of a ton of other stress. So it's really good to kind of talk about some self-care strategies in relation to this. So I literally took this information from the National Center for PTSD website, and I'll post their website in the descriptions and comments. So when we're talking about the pandemic, oftentimes we think, I don't have time. I am going from patient to patient, or I have way too much on my plate, not to mention my family as well. And so just saying that you don't have the time and not taking care of yourself continues to put you at a higher risk. And so just make sure that you take the time for yourself. You are number one. And if you cannot take care of yourself, you are not going to be helpful for your patients, or your family, or anybody else. So we have to come first as providers. So being aware of that and asking for help when we need it. If we are encountered with a really difficult decision, making sure that we are asking for support during these difficult times, especially the times where we are kind of challenged with our morals, and or asking other people to help make these decisions. Then it doesn't become like that blame game of, I made this decision. It then becomes a we thing of, we all made this decision and we're in this together. And I think that's very important, to make sure that you're relying on your team. So the National Center for PTSD website mentioned a few different apps that are very helpful, especially during this time and what everybody's going through. So there's a very new one through the VA called COVID Coach app. And it's a really good one to look up, as well as there's another one called Provider Resilience app. So I suggest that you check those out, especially if you're a provider and you're on the front lines. This will be very helpful to walk you through the process. Also being aware of your internal self-talk. So changing the way that we're talking to ourselves instead of constantly being in the negative and beating up ourselves and blaming ourselves, changing things around. So instead of being like, that was, that was my fault, or that person died because of me, changing it in the aspect of, in that situation, that person may have passed away or died, but I did everything I could in my power to help save that person, and the rest is out of our hands. And it's just a great reminder for ourselves that we can only do so much, and there's only so much that we can control, and that is ourselves and what we know and what we do, but we don't control the outcome in the aspect that we can perform a fabulous life-saving measure, and it might just not be what works. It just may not be what is meant to happen. It might not be that that it's the perfect treatment, but as long as we do our best and we do everything that we can in that moment, that is all that we need to remind ourselves of. And unfortunately, bad things happen to great people. And so recognizing that we just don't have the control of the outcome, and we're not all powerful, so to speak. And just, reminding yourself that it's to focus on that internal self-talk and how you're talking to yourself, and be more positive and give yourself more credit than oftentimes in this field individuals do. There's also more options if you go to the link in the comments or the description, that will have links to other resources within that link. So you'll go to the website and you'll scroll down and it'll talk about, ways to kind of cope. And there are different options in there as well, and resources. And they're fabulous things of helping you kind of change your thinking surrounding the COVID pandemic and everything that's going on. And lastly, just kind of making sure that we are helping our coworkers. We're being present. We're focusing on how our coworkers are reacting, reaching out to those who are showing signs of distress and letting them know that, we're concerned, yet, know that they may not want to talk about it at that time, and be respectful of that. And like I said, so just let them know that you're concerned, you care about them, and that you're there for them, that you're willing to listen when they're ready to talk. Sometimes just that offer is enough for people to either be willing to open up, or it just invites them to kind of work through some of this stuff. Even suggesting that they talk to someone. Oftentimes when you are seeing that other people are distressed, you're likely experiencing some of that distress yourself. And especially if you're recognizing that you're kind of going through a lot too, recognize that stress that you have. And even though you want to be there for your coworkers and the other people that you're fighting with against this pandemic, making sure that you recognize again that you are number one. And if you're not in a spot that you can help, but you see a concern, let them know. Say, hey, I'm concerned about you. I don't feel like I'm the right person to help you, but I want you to know that there are options, and lead them or guide them into the spot of where they can go to talk about it. Especially if you're not in the space or the mental space to even do that yourself, or maybe you need that yourself as well. And so just guiding them, giving them a resource. If you are in a space where you can listen, just be a good listener. Validate them on how they're feeling and what they're going through, and recognizing just how hard everything is that you guys are going through right now. But reminding each other that you're in this together. And supervisors as well, there's a couple good things to just be aware of is make sure you're checking in on your employees regularly. Even if people are saying, I'm fine, make sure it's regular because that can change, day to day, hour to hour. Identify and openly discuss and talk about stress and moral injury and what that looks like, especially with the pandemic and within your workplace. Each workplace is different. The pandemic doesn't just affect our first responders. Thinking about all essential personnel, we're even talking about grocery store workers, that are constantly among the whole entire community and being exposed in that manner as well. And that can create some occupational stress and anxiety too. So just recognizing that no matter what field you're in, this is an important topic. Showing your gratitude. Simple gratitude can go a long way, and just letting your workers know how much you appreciate them and what they're doing, especially during this stressful time. Providing support and referral sources, even if you think that you're in a position where maybe someone isn't experiencing trauma, if you have EAP services, let your employees know. Figure out what the insurance companies that you guys provide to your employees, if you do, like what do they cover? Who do they cover? Who are some of the community options that they can go to, or even agencies in the area? Finding, people who have a sliding scale fee that can provide reduced rates. And so making sure that you're making those connections with your employees and just normalize their potential reactions. Because we're talking about a circumstance that nobody truly predicted would be where it's at today. So with that comes reactions that we wouldn't have predicted that we would be experiencing ever in our life. And so just normalizing that this is a tough time and that people are going to be experiencing different things and that help is available. And as always, I just want to leave you with two different phone numbers. One, SAMSHA, so Substance Abuse and Mental Health Service Administration, has a disaster distress helpline, and their phone number is 1-800-985-5990. I'm going to say that one more time, 1-800-985-5990. So that's the disaster distress helpline. And it's immediate crisis counseling for anything that's emotional distress related to any natural or human caused disaster. So that is very, very important resource during this time. And then as always, it's free, it's confidential, it's 24/7, 365 days a year. And I just urge you, if you're really experiencing some difficult stuff right now, to contact them because they have trained people available. And finally, as I always discuss, the National Suicide Prevention Lifeline, and their number is 1-800-273-8255. Again, they are also free, confidential, 24/7, 365 days a year. Please, if you are struggling with anything that we've talked about or any other mental health related issues, please reach out and ask for help. And as always, if you're wanting to look for any type of therapy services, please reach out through different agencies or the social services in your area can kind of connect you with different therapists in your area. Thank you guys, and I hope you learned a lot about moral injury and how our different occupations can affect how we are feeling, especially amongst this pandemic. Have a good day.